Top 10 foods to avoid when taking blood thinners. Like warfarin. Blood thinners, such as warfarin, are prescribed to prevent blood clots and reduce the risk of stroke and heart attack. However, maintaining the right balance of these medications can be tricky, as their effectiveness can be significantly influenced by diet. Certain foods can interfere with how warfarin works, either by increasing its blood-thinning effects or by reducing its efficacy. Here are the top 10 foods to avoid when taking warfarin and why they pose a risk. 1. Leafy green vegetables. Examples: spinach, kale, collard greens, broccoli. Leafy green vegetables are rich in vitamin K, a nutrient that plays a crucial role in blood clotting. Warfarin works by inhibiting the action of vitamin K, thus reducing the blood's ability to clot. Consuming large amounts of vitamin K can counteract the effects of warfarin, making it less effective. It's not necessary to avoid these vegetables entirely, but it is important to consume them in consistent amounts to maintain stable warfarin levels. 2. Green tea. Green tea contains a moderate amount of vitamin K, which can interfere with the action of warfarin. Additionally, green tea has compounds that may enhance the blood-thinning effects of warfarin, increasing the risk of bleeding. If you enjoy green tea, it's best to consume it in moderation and inform your healthcare provider to adjust your warfarin dose accordingly. 3. Cranberries and cranberry juice. Cranberries and cranberry juice have been reported to interact with warfarin, potentially increasing the risk of bleeding. While the exact mechanism is not fully understood, it is believed that cranberries can enhance the anticoagulant effects of warfarin. If you are taking warfarin, it's advisable to limit or avoid cranberry products and discuss any consumption with your doctor. 4. Alcohol. Alcohol can have a complex interaction with warfarin. Chronic alcohol consumption can decrease the effectiveness of warfarin, while acute alcohol consumption can enhance its effects, increasing the risk of bleeding. It's important to consume alcohol in moderation and ideally avoid it altogether while on warfarin. If you choose to drink, do so under medical supervision to ensure your INR international normalized ratio levels remain stable. 5. Grapefruit and grapefruit juice. Grapefruit and grapefruit juice can interfere with the metabolism of many medications, including warfarin. Grapefruit inhibits the enzyme CYP3A4 in the liver, which is responsible for breaking down warfarin. This can lead to higher levels of the drug in your bloodstream and increase the risk of bleeding. To avoid this interaction, it's best to steer clear of grapefruit products while on warfarin. 6. Garlic. Garlic, especially in large amounts or in supplement form, can enhance the blood-thinning effects of warfarin, increasing the risk of bleeding. While garlic is known for its health benefits, it's important to use it cautiously when taking blood thinners. Discuss with your healthcare provider before taking garlic supplements or significantly increasing your garlic intake. 7. Fish oil and omega-3 supplements. Fish oil and omega-3 supplements are popular for their cardiovascular benefits, but they can also have blood-thinning properties. When taken in combination with warfarin, these supplements can enhance the anticoagulant effects and increase the risk of bleeding. If you are considering taking fish oil or omega-3 supplements, consult your healthcare provider to determine the appropriate dosage and monitor your INR levels closely. 8. Soy products. Examples: tofu, soy milk, edamame. Soy products contain vitamin K and can potentially interfere with warfarin therapy. Additionally, soy contains phytoestrogens, which may affect the metabolism of warfarin. If you consume soy products, it is important to do so consistently and in moderation. Keep your healthcare provider informed so they can adjust your medication dosage as needed. 9. Avocados. Avocados are rich in vitamin K, which can reduce the effectiveness of warfarin. While avocados are a nutritious food, it's important to monitor your intake and maintain consistency if you choose to include them in your diet. Inform your healthcare provider about your avocado consumption to ensure proper management of your warfarin therapy. 10. Certain herbal supplements. Examples: ginseng, St. John's wort, ginkgo biloba. Herbal supplements can have unpredictable interactions with warfarin. For example, ginseng can reduce the effectiveness of warfarin, while St. John's wort can decrease its levels in the blood. Ginkgo biloba, on the other hand, can increase the risk of bleeding when taken with warfarin. It is crucial to avoid these supplements unless advised by your healthcare provider, as they can significantly impact your INR levels and the efficacy of your medication. Managing your diet while on warfarin. Maintaining a stable and balanced diet is key when taking warfarin. Here are some general tips to help you manage your diet and medication. Consistency is key. Aim to eat consistent amounts of foods high in vitamin K. Sudden changes in your intake can disrupt your INR levels and affect your medication's efficacy. Monitor your INR levels. Regular blood tests to measure your INR are crucial. This helps your healthcare provider adjust your warfarin dosage to keep your blood clotting at a safe level. Inform your healthcare provider. Always keep your doctor informed about any changes in your diet, including new foods, supplements, or significant changes in consumption patterns. Read food labels. Pay attention to food labels to monitor the vitamin K content in your food. This will help you maintain a consistent intake. Limit alcohol and herbal supplements. Both alcohol and herbal supplements can have unpredictable effects on warfarin. Limit your consumption and discuss any use with your healthcare provider. Educate yourself. Understanding the foods that can interact with warfarin and how to manage your diet effectively can empower you to take control of your health and prevent complications. Conclusion: warfarin is a life-saving medication for many individuals at risk of blood clots, but it requires careful management to ensure its efficacy and safety. Avoiding certain foods and maintaining a consistent diet can help you achieve stable INR levels and reduce the risk of complications. By working closely with your healthcare provider and staying informed about dietary interactions, you can effectively manage your health while taking warfarin. Remember, while this guide provides general advice, each individual's response to warfarin can vary. Always consult with your healthcare provider before making any significant changes to your diet or medication regimen. Significant changes